Hi everybody, thank you for joining us today on Candid Chats, all things wellness. I am sitting down today with Jennifer Melancon, who is with Cedar Physical Therapy and Wellness outside of Dallas, Texas. She is a neurokinetic therapist, and she's here to talk to us today about how we can help to balance our body, and she's also going to talk to us a little bit about scars and how they affect us in our daily life and in our health. How you doing today, Jen?
Doing well. Thanks for having me, Candid.
So, go ahead and tell everybody exactly what it is that you do and what kind of physical therapist that you are.
Sure. Well, like Candid said, I'm a physical therapist, and I've worked with children and adults and athletes throughout my career, and I found where I'm really passionate is about the brain, and so I do neurokinetic therapy, which looks at how your brain is organized to your muscles. And it's so cool because you can make really amazing changes by figuring out the puzzle of how your brain's using your muscles to help with chronic pain issues, to even changes in the way you walk, the way you move, the way you play sports, the way you work out. So
you help with like concussions and things like that on the...
I have worked with some folks who have had concussions and have been able to help with that.
Very good. All right, so we're going to ask Jennifer, how does physical therapy help everyone in their daily life?
Yeah, so physical therapy is awesome because it helps keep your brain communicating well with all of your muscles. It also can help with range of motion issues, pain issues, strength issues, and just being able to function and do the things that you love to do or want to do in your daily life with good body mechanics and without either hurting yourself or being at risk of hurting yourself.
Right. Just to touch on this real quick, explain to everybody what range of motion means.
Range of motion is just the ability for a joint to move. So for example, the shoulder flexion means it can move all the way up here, and then all the way down. So just how your joints move fully.
Right. Okay, very good. Yes. I see a lot of patients with frozen shoulder, so I wanted you to explain that. Because they'll be stuck here, and then next thing you know, their arm is actually going all the way around. And I do think a lot of time it is a mental blockage that they're having. They have to breathe through it for them to actually be able to fully rotate their shoulder. So it's just interesting, muscular, bone-wise, mental connection, brain connection, as you said, all of that. So do you actually have a focus or a special area of interest that you specialize in?
Yes, I specialize in scars. I'm the scar lady.
Yeah.
So a little bit about how I got interested in this is I took the first neurokinetic therapy class, and they taught us about how scars can change the way their brain will organize your muscles and choose to use them. And I started seeing like significant improvements with people being able to move better and hurt less, because their scar was basically like hogging all of the muscle power for just, an example of that.
Right.
So just a little science lesson. Motor control, or how our brain chooses to move us, is driven by sensory input. So if there's trauma to your skin, whether that's a little scratch that scabs, if you've had a burn, a piercing, a tattoo, or a scar, that gives your brain different inputs because all these receptors are now altered.
Right.
So the brain gets different information in, so it chooses to use your muscles differently.
I've actually heard that if you have piercings, it blocks your energy flow in your body. So
that
now
it
makes a little bit more sense to me
Yes.
because it's creating a scar
Yes.
where the piercing is.
Yes.
Okay. So if someone comes to you for physical therapy, what gives you a signal that, or because some scars are internal.
Yes.
So how would you know that they needed to have this specific type of therapy?
Oftentimes I'm going to ask every time I'm going to ask in my history, like take a deep dive, like going back to like even childhood injuries, like do you have scars because you fell and scraped your knee when you were a kid? What surgeries have you ever had? Do you have any tattoos? Do you have any piercings? And get all of that information, and that helps me to know where to start.
This is interesting to me. So if somebody, how people have like a full sleeve, what do you see with that?
Oftentimes what I see with that is that their brain does not connect properly with muscles in the back, like their lats and their shoulders, and muscles in the arm, it's not getting the right signal through.
So it's causing like fatigue or?
It causes compensation. So your brain it starts to borrow from Peter to pay Paul to allow you to do what you want to do. Because your brain's first job is to keep you safe, and then its next job is to keep you functional.
So it can actually cause distortion in a completely different area of the body, all because of your arm.
Yes.
Okay.
So it's not uncommon for somebody, for example, like say you had your belly button pierced, like that their brain cannot find most, if not all, of their core muscles. And by find, what I mean is that it doesn't have a good signal to that muscle. So I do manual muscle testing. So like I'll do a test and say match my pressure, and I very lightly push down. And if there's a good signal, their arm should be able to push up as soon as I push down. If there's a delay, a quiver, or they just like, I'm trying, but I just can't, that's not a good signal.
And all from a belly button piercing.
Yeah, so I'll find like one of the core tests, and then I'll say, put your hand on your belly button on that piercing. And where they could not match my pressure, all of a sudden, bam, like their muscle is turned on, it's strong, and their brain can find it. Because you change the sensory input, you put your hand over that piercing.
It brought attention to that area, right?
It reconnected it to where the brain could find it again, and all of a sudden, oh look, we can find that muscle.
That's awesome. And so when you think about a belly button piercing, so many women have also had, ovarian cysts, ovarian cancers, C-sections, all of these things that cause internal scar tissue that we obviously don't see on the outside. So I'm sure all of that is brought up in consultation to help you to understand any surgeries that they may have had that's causing the distortion.
Right. So what we're looking at is in which ways the brain is not allowing the skin to move. And so it depends on how many layers have been cut through. For example, in a C-section, you've got the layers of skin, the fascia, and the muscle that have all been cut through and then re-sewn back together. So there's a lot of layers of scar tissue there. But if you can get the skin to move well in all the directions and then relink it to the muscles that we're having a hard time and repair those together back to back, give your brain a new way to move. And it's amazing in how their stability increases, their pain decreases, and you're able to like, oh my gosh, I can pick up my kids again without hurting, or I can sit in the car and drive and my back's not killing me.
So do you feel like so whenever you're doing the distortion release, or is that what is it called, distortion release?
It's just a fascial
release. Even if it's an internal scar, are you just doing that through stretching, or how are you breaking up the scar tissue?
I use my hands manually. Sometimes I'll use a tool to assist me. And then I also just got this really cool new tool last weekend called the Dolphin. And it is...
Does it look like a dolphin?
No, but it sounds like one. It's a little handheld tool in each hand. And what it does is it actually changes the polarity of the scar, which is positive, back to negative, which the rest of our skin is.
Okay.
And so it helps
it
release...
changes the brain signal? Is that what it's...
It literally changes the skin.
Okay.
So I've seen scars like literally like fade away and almost disappear as I'm treating it, which is way cool.
Yeah, that sounds awesome. I'd love to see that.
Yeah, and scars affect the brain. It puts you at an increased, hang on, what's the right word here?
That's okay.
Like your body is more prone to go into fight or flight. Like it increases your sympathetic dominance. Yes. And then scars, if you've got, say I had a scar here, well this is fascially connected from here all the way through.
Yeah.
And so if there's a stuck part here, there's going to be tension all along that whole fascial chain. So if we can release that, it lets everything else move more, which in turn lessens your risk of having chronic pain.
And that's so common because a lot of people had ganglion cyst or carpal tunnel surgeries. I see tons of people with carpal tunnel surgeries.
Oftentimes that's because there's issues closer to the neck and compression throughout that are compressing that nerve, and that sometimes can be actually corrected with doing NKT and getting the muscles to quit compressing that nerve up here.
So just loosening here, unwinds,
and working
all the way down.
Yes.
So that's very good to know, because I know a lot of you guys out there are dealing with carpal tunnel from working on the computer all day, or a lot of you guys drive all day for a living, and truck drivers and stuff like that. And even in what I do, massage therapy, I'm constantly moving my hands, so we have to do hand exercises and rotations. Just that's good to know, because you never think about your scars here affecting any other part of your body, or any other part of your body causing
more
something
trauma
else to be
in another place.
happening down there. All right, so we talked about changes to the skin and how what you do can actually reverse the polarity of the skin to change it back. What about trauma-causing instabilities?
So,
is it like childhood trauma?
It can
stuff,
be
or
any
physical
kind of
trauma.
It can be any kind of trauma. Like say you're a kid and you skin your knees on your bike.
Mm-hmm.
Like if your brain borrows how it uses muscles to, like, oh, that hurts, I don't want to use that right now.
Mm-hmm.
And you start maybe walking a different way. Like it can hold on to that pattern, that compensation, until you tell it to do something different. So it can literally affect you years and years later.
You're making me think about the scar on my knee right now, and I've had that since I was in 3rd grade. So
that pretty sure will be affecting at least one or more of your
muscles.
brain's connection to your leg muscles. Yes.
Oh, could that go as far as causing scoliosis, or?
It is possible.
Pulling on the muscles?
I've actually seen really cool results with people that have functional scoliosis, meaning it's a muscle mismatch, abnormal pull. Because if you can start to pick through some of those layers of how the brain is compensating, I've seen really cool how spine just go whoop, straighten out.
Yeah. Wow. Okay. I'm peeling back in my brain right now, you guys, and you probably are too. So it really makes you think about a lot of things, though, because we always go to one specific doctor for one thing and think that we can take a relaxer for our muscles, or we can just continue with our adjustments, but then you never even think of it as something coming from your skin issue or a scar issue. So that's very interesting. What are some of the instances that you've helped with?
What commonly happens is somebody will come to me and they'll say, my back hurts, my neck hurts, my hip hurts, whatever. And by looking at their whole body, how they move, I'm able to help kind of pick through that. So a common one I get is ladies who come to me and they have low back pain or neck pain. And then going back through their medical history, if they've had a C-section, for example, I'll do all of the back tests.
Right.
And then have them put their hand over that scar, and their muscles will turn from weak to strong. So we do scar work, and then I can give them very specific homework exercises to get their brain to re-engage to their core, and then we've got to strengthen that new motor pathway. And then your brain can actually find the muscles. So traditional strengthening you do works. So I always start with getting your brain to find all the muscles, and then we move into the strengthening phase at the end.
Is it always a pattern you see with scars? Say a C-section scar kind of causes the same areas to be imbalanced, or say they had a scar from a breast surgery or something, would that create a distortion in another area of the body?
I've found that almost all back scars or abdominal scars affect the core muscles in some way. For the example you gave, what you probably see is the brain not finding their pectoral muscles well, their big lat muscles here, possibly some of the shoulder muscles, and also possibly some of the core muscles too.
So they would probably have a lot of shoulder pain?
That could be very possible, or even limited range of motion. Okay.
Is there any other areas that you see a lot of that you can connect the dots for them?
Yes. If you've ever had a knee scope, an ACL surgery, or a knee replacement, I would say 98% of the time find that your brain can't find your quad muscle properly and your glutes.
Okay, I think you really just solved something for one of my patients, because I have a lot of elderly patients I work with who have had knee replacement surgeries, and they have the scarring on both knees sometimes. And I do have one patient, and she actually has this phantom hip issue. She's walking with a cane now, and they cannot figure out at all what's causing it.
Yeah.
So,
wow. I can probably definitely help her.
I think I'm definitely going to refer her to you.
A cool story. I had this elderly patient in the past, and she had a hip replaced 8 years ago, and her skin and her scar was kind of indented
in. Yeah.
And she had been to all the doctors, had all the tests, and they're like, your hip prosthesis is fine, it's stable, there's nothing we can do, and found that her scar was the problem. And so we did scar work with her, and after the second session, her 8 out of 10 pain, she came back, she's like, this is amazing, my pain's like a 1 or a 2.
Yeah.
So we kept doing that, and then transitioned into strengthening. And we had her pain-free, and she had been hurting for 8 years. And nobody could figure out why.
Yeah.
But it was from her scar.
It's like it's a bittersweet thing, right? Because you've been hurting for so long, and you're so excited now that you are feeling better, but then you're so upset that you've been hurting
sooner
for 8 years. So I really hope you guys are watching and listening and paying attention, because we could probably help save you from years of pain and more trauma.
Yeah, and the cool thing I just learned this weekend is with my new dolphin tool, you can literally start treating an incision the day it happens, just around the dressing. So there's hope that you can start getting at it right away and early, and not letting your brain have to go through all these compensations by early treatment. To avoid, potentially all that chronic pain in the future.
And I know this, it seems like an unnecessary thing to cause this kind of trauma to the body, but a lot of people do have like tummy tucks and those kind of alternative surgeries done that weren't necessarily caused from trauma, but are causing trauma. So for those people, a lot of times I see like they have really thick scarring. It's not like a mild scar. Is that even something you can treat whenever they're really thick scars like that?
Absolutely. It may take more time if it's more thick and there's more scar tissue, or more treatments with the dolphin, or combination of that and the manual work.
Yeah.
But absolutely, all of those surgeries, breast reductions, breast augmentations, mastectomies and reconstructions, and tummy tucks and body lifts, and it's any scar, and it can even be a scar this big can cause the trauma. So it doesn't really matter where it comes from. It's just the...
Because even I think shoulder surgeries now, they just do like a little invasive, little bitty scope, and that still probably leaves a scar, right?
It does.
All right, so I hope we have learned something today. Is there anything else that you want to add, that you want to share with them? I know that you do come here once a month, it is?
Yes.
Okay. So Jennifer does come to Lafayette area once a month from Dallas to actually see people and do consults and treatments. So is there anyone in specific you want to reach out to?
I can help anyone who has had any type of surgery. Even if it was years ago in the past, that's actually more reason to do it, because your body has been holding on to that trauma from that scar for even longer.
So it's going to be more of a wellness.
Yes.
I don't want to say procedure, a wellness.
Like a wellness consultation just to help you to feel better and to move better and to be able to really enjoy your best life.
Very good. All right, so if you guys want to set up a consultation or meet with Jennifer and get on her schedule, because she only comes once a month, so make sure that you hop on with her. I'm going to go ahead and let her give you all of her information to where that Jerry today, so that you guys can meet up with her. Okay, what's your information, Jen?
You can call me or text me at 469-609-0778.
Okay.
You can find me on Facebook as Jennifer Melancon, or my business Cedar Physical Therapy and Wellness, PLLC.
Okay.
I'm on Instagram as Cedar PT Wellness. And you can email me, jennifer@cedarptwellness.com.
Did you give your website?
Oh, website, www.cedarptwellness.com.
Very good. Anything else you want to add before we log off?
No, I don't think so.
We hope to see everybody, right?
Yeah. I do free phone consultations, so we can set up a time to chat about whatever's going on with you. I'd be happy to talk to you.
That's important, since everybody's, mostly in this area.
Yes.
So, Can they set that up on the website, or do they need to call you to set up a consultation?
If you would call me or text me to set it up, that would be great.
Okay, and your phone number is also on your website,
Yes.
correct? Okay, we're going to go ahead and post all of Jennifer's information below this video today, and obviously we're going to post the video like we normally do more than one time, so if you guys want to hop in on any watch parties, you can, and we'll both be available to answer any questions that you have. And I just want to thank you guys for joining us again today on Candid Chats All Things Wellness. I hope to see you again next time. Y'all have a great day. Bye-bye.
Bye-bye.